Hello everyone, my name is Hilmersson. I'm the Deputy General Secretary of the European Trade Union Confederation. I'm very sorry I can't be with you today, but I will join you tomorrow. The ETUC strongly supports this conference organized by the ETUI, taking stock of 30 years of the EU Framework Directive on health and safety at work. And more importantly, looking forward with the new European Parliament and European Commission on what can be achieved in this area. The Framework Directive was an important trade union victory that made it possible to improve prevention systems throughout Europe, and which was based on the experience of a renewal of struggles around occupational health and safety that spread through Europe in the 1970s. Among the main developments, at least partially enshrined in the 1989 Framework Directive, are a move away from an emphasis on monetary compensation for the damage done by work to a prevention focus, promoting the notion of health is not for sale. A shift from a focus on the individual to the collective conditions that determine health, with the understanding that it's not the worker that is sick, but the business. A shift from a technical approach where rules devised by specialists ordained what is healthy and safe to a social technical approach where workers move from being the object to the main subject of prevention because workers themselves are the primary specialists in the working conditions. A requirement for all workers to be equally covered by health and safety laws regardless of their status. This was a big step forward in many countries where prevailing rules created a wide gap between civil servants and private sector workers. Previously, entire categories of workers, for instance in agriculture, fishing, family businesses, cooperatives, religious foundations, were covered by no or only lowest common denominator rules. A defined general safety obligation requiring a result to be achieved combined with fairly specific criteria on all means to be used, like prevention planning, risk assessment, establishment of preventive services, and employee representation. At the same time, this ETUI conference is forward-looking. For trade unions, occupational safety and health remains a top priority. It is the starting point for significant social inequalities in the face of illness and death. To address them, we need both coherent legislation and democracy at the workplace. This is why, in the coming mandate, the ETUC will focus on the Commission to adopt a new EU strategy on occupational safety and health, including the following priorities. The promotion of new and improved national OSH strategies. Trade union involvement in a meaningful manner at all levels in the design, implementation and evaluation of the EU OSH strategy. Supporting implementation in micro, small and medium-sized enterprises and enlarging the scope of the strategy to the self-employed. Enforcement of EU OSH regulation is crucial to protect workers' lives and health and to guarantee that EU law related to OSH is applied throughout the EU, while giving member states the right to implement regulations that are more favorable for workers. All workers in the EU should come under the protection of OSH legislation, taking into account the negative effects of digitalization. Preventing work-related diseases, harassment, accidents and fatal accidents at work. The ETUC is calling for a zero vision on fatal accidents in the new EU strategy. The new strategy must address the major causes of work-related diseases such as cancer, mutagens, reprotoxic substances, ergonomics and psychosocial risks. The ETUC demands a continued revision of the CMD directive and a new directive on psychosocial risks. Improving statistical data collection and OSH evidence base. Strengthening international cooperation and mainstreaming OSH. I hope you will have fruitful and interesting discussions today, and I will see you tomorrow. Thank you.